Thanks for joining me today. This is a very specific practice, as you may note in the title, for something called Thoracic Outlet Syndrome. However, if you're not familiar with it, you probably don't want to be, and you can do this practice to avoid it perhaps. Thoracic Outlet Syndrome has to do with a group of nerves called the brachial plexus, that if you just touch your upper chest area right around your collarbone and your upper ribs. So really it has to do with your upper thoracic spine. And it's a nerve impingement, which means your nerves are being smushed. And just like your muscles move when you move your arms, your nerves are supposed to move too. But when they're smushed, they can't. So it's definitely aggravated for most people when they lift their arms up. That's one way you'll know. But you would feel it as perhaps even tension in the neck or the chest itself, because it has to do with like pectoral muscles, the scalene muscles in the neck. But a lot of people will feel it down the arm, and this is the nerve impingement. It can also, unfortunately, impinge other things like arteries and veins, but the most common one is nerve impingement. And down your arm, it might even feel like a carpal tunnel syndrome or a numbness in your hand. So those are some of the symptoms, and I've just put that little picture up. You can see the other thing we note is that because we are a society that sits a lot, we see a lot more kyphosis, which is the roundness of the upper back like this. Go ahead, put yourself in that position that we all sit in too often. And what that unfortunately does, it goes hand in hand with this syndrome because we're closing off that front body, right? We're shortening the muscles and impinging the nerves. So this practice will have a couple different parts. We're going to start seated. You can be seated. You could also do the standing if you're at your desk. And then we're going to finish on the ground with some somatic movement. The first part we're doing is what we call nerve gliding or sliding. So we want to come into a seated position or standing where we feel like we have a nice posture. Take a big breath in, and then as you breathe out, just let your shoulders fall over your hips and let your ears fall over your shoulders. So we're not holding ourselves tight, but if we're in that slump position, the breath in is like a balloon and it comes and lifts us up. And then find that space where you're holding your spine in a nice neutral position. And we're going to start by just taking our left ear and gently bringing it over to the left shoulder. Just drop it. So I'm not turning, I'm just dropping it in a lateral bend. So you'll notice you can do that a few times. As you do that, what you're doing is you're stretching or putting tension on the right side of the neck, and you're laxing or relaxing the muscles on the left side of the neck. So if you have this in the left side, this is how we'd work through it. Next time you get your ear over there, just pause for a moment, see if that feels good. Relax the shoulders. Imagine like weights in the tops of your shoulders, gently drawing your shoulders down, your armpits down. And then we're going to take just the left arm, and you're going to start by bending the elbow, keeping the wrist floppy, and slowly begin to lift the elbow up. And as you lift the elbow up, extend the arm out. And then slowly bring it back. You can keep the head there, or if you feel like you need to come back to center, come back to center. So one thing knowing anytime we're working with the nerves, it should not increase pain, and we definitely don't want any sort of pain that feels electrifying. So that's it's telling us that we're unfortunately aggravating the nerves. So as we do this, we're going to add a little bit in each time, and if it aggravates it, that's your point of stopping. So you can drop that head again. Elbow bent. Begin to lift the elbow and extend. And now if you want to go a little bit further, extend your fingers too, and think of reaching the fingernails down towards the ground. So you're taking your back of your hand towards your arm. Slowly release the arm back down. If you can just leave the head there, do that. So the idea here is to move slow, go into full extension. So as we move the muscles, we want the nerves to move with the muscles. And just check to see that this is not aggravating it at all. And take it back down. Take your head back up if it's still there. We're going to do that same thing, but this time we'll make it a little bit more sensation by dropping the right ear to the right shoulder. And maybe just do that a few times first. Just see how that feels now to stretch out that left side of the neck, to put tension in the left side. The right side is relaxed or laxed. And next time you have the right ear over the right shoulder, relax the jawline. Same movement with the arm. Lift the left elbow up and extend the arm. You can kind of do that in at the same time. Maybe just extend it first, see how that feels. Take it back down. You're extending, and then if you want to take the fingers and reach the nails down towards the ground, so feel the stretch through the whole hand, through the front of the wrist. And keeping, I notice for me, I'll start to tense my jaw, so keeping the jaw relaxed and the eyes. Just do one or two more of these. Very simple. So remember, we're not really trying to stretch muscles. It's not about that. It's certainly not about building strength. Think of your nerves going all the way through. So the neck nerves are what run all the way down through your fingers. And then relax that. Come back to the center. The medial nerve is one that we're working with right now. And then the next movement we'll do, we'll continue with that left side. You're once again going to drop the left ear to the left shoulder. But this time, you're going to keep the palm facing down. And you're going to lift the arm up to about the height of the shoulder. And then once you get there, think of your arm bone internally rotating. So you're going to roll your thumb down towards the ground and roll your arm forward. Internally rotate the arm. Your head is still hanging. And then slowly push your hand back behind you, like you're pushing something behind you. Check to see. You should feel a little stretch right in the head of the arm bone here. And then one more thing we can do here, if it feels okay, start to pull the back of the hand towards the arm again. So you're taking the wrist into extension. And as you do that, bring your head to the right shoulder. And then we go back and forth. Release the hand, bring the head back over the left shoulder. And then pull the hand towards the arm into extension, and then take your right ear to your right shoulder. Sometimes I just get too relaxed doing this. Take a few of these. And just focus on this area of the left side of the neck, through this collarbone area, the head of the arm bone, all the way down through the hand. So we're relaxed when the left ear is over left shoulder and the wrist is relaxed. And then we're kind of gently tugging on that nerve as we take the right ear to the right shoulder and push through the hand. And let's stop that. Come back. Pause. Notice how you feel in between, particularly the two sides of the body. And we're going to continue with a pattern similar to that, just change it up a little bit. But again, if at any point you feel like this is aggravating the nerves, if there's like a spicy feeling, then you got to stop. So we're going to drop the left ear to the left shoulder again. Relax both shoulders. Let them be heavy. Lift the left arm to the height of the shoulder with the palm facing now down. Now, last time I had you internally rotate the arm. Now I want you to externally rotate the arm. So your palm will flip up and your thumb to the back, and your arm bone will roll away from the front of your body. We're still here. Just do that a couple times. See how that feels? Can you feel that in that upper left shoulder? Where do you feel that? Maybe right through the front of the shoulder. And then we'll do the same extension of the wrist and dropping to the right. So you're going to draw the back of the hand towards the wrist, push through the palm. I like to spread my fingers and simultaneously bring the right ear to the right shoulder. So this is like at this point when right ear is to right shoulder and you're reaching through the palm, you're stretching those nerves from both ends. So this is like as far as we can go here. You can even pause there for a moment and then let the wrist go, drop your head back. Remember to keep that arm externally rotated. And check to see you're not squeezing the shoulder up towards the ear. I tend to do that too, so let it be soft. Think of dropping your armpit. So there's that ease of palm relaxes, head comes back over the left shoulder. And just exploring that area. And take it down, let it relax again. And pause. Feel both sides of your body. And can you feel a difference? And oftentimes we'll have this on just one side, so you can do the one side, but if you've been sitting at your desk, it might be good to do both. So let's do the right side now. So pausing for a moment, Start with just feeling your right ear and let it come towards your right shoulder. You're getting that nice stretch to the left side. You're relaxing the right side. And come back to center a few times. You can do this with your eyes opened or closed. And next time, your right ear is to your right shoulder. We're going to take the right arm and bend it. And this first one is when the palm is facing up. You're going to slowly extend the right arm out with the palm facing up. And so this one should be the least amount of sensation. So if you do have the thoracic outlet syndrome, this is a good spot to start with, making sure this isn't aggravating. See if you can feel it all the way through the palm of your hand, through your fingers, your wrist. And then you can start to reach through the hand a little bit more. Spread the fingers apart. Spread the thumb away from the index finger. And see how that goes. Come back to laxed. So you're just locating too this area all the way from the side of the neck, the upper front chest to the fingers. Think of those upper ribs and your collarbone. And then we'll pause. Check in with your whole body. Sometimes what happens is we try to release tension in one spot and it all shifts to another area. It could even be your back, so you can recheck your posture. And then we'll do that same one, but we're going to be bringing the head to the left. So you can drop your head to the left. See how that goes? There's going to be a little more tension put through the neck there now. And then palm facing up, begin to slowly extend the right arm up through the elbow and the arm. And release it down. Notice if you feel it differently in this side. And you can really reach to the fingers, spread your palm out. Think of the space all the way from, I like to visualize my index finger coming through the center of the wrist and all the way up through the top of the shoulder, the right side of the neck, through the front of the chest. You can even breathe into your upper chest a little bit. And we'll take that down. Relax it again. Let your arm come down. Pause. All right, moving on to the second movement, we'll go back to bringing the head to the right. So drop your right ear to your right shoulder. Pausing there. This is the one where you'll start with your palm is going to be facing down. So you're going to extend your right arm out to about the height of the shoulder. And just do that for a moment. See how that feels. And the next time you do that, extend it out, but then internally rotate the arm. So think of your arm like, I would say it's like a rolling pin. You're going to roll it inward, and you'll feel things tighten up a little bit more in the collarbone area and the head of the arm bone. And then once you find that, draw the back of the hand towards your nose, and bring your left ear to your left shoulder. And you can just do those movements, keeping the arm out to your side, internally rotated, left ear to left shoulder, and it's like the back of your hand is following your left ear, right? As the left ear goes towards the left shoulder, the back of the hand is coming towards your nose. Stay with it, stay present in your body, and it may be simple sensations. Be thankful if it is. And drop it down, let it relax. We'll do that same movement this time with the external rotation of the arm bone. So you're going to start by dropping the right ear to the right shoulder, so let that right side lax and relax. Lift your arm up with the palm facing down. Now you're going to externally rotate the arm, so think of flipping your palm up towards the sky, thumb back. And then once you get there, you're going to bring the left ear to the left shoulder, draw the back of the hand towards your arm, push through the palm, spread your fingers, and find that little dance. Think of all the way from the fingertips, through the neck, through the crown of the head, and you're creating space from the fingertips to the crown of the head. That's when we're stretching those nerves at both ends and then releasing them. Or flossing is a nice term for it. You're welcome to do one more. I like to do it in movement. Some people hold it for a moment. Check to see you're not letting that tension land somewhere else in your body. And then come back down, release. Pause for a moment to feel the two sides of your body, particularly your neck. For me, my neck feels longer. If you have any new experiences, you can write them in the comments. I always appreciate hearing that. And in the meantime, in the magic of film, next time you see me, I'll be down on the ground on my mat, and you can do the same. Well, this next movement is going to be more in the line of somatic yoga, and we're going to do it lying down on we'll start from the left side. You can see I have a towel here. You can also use a pillow. But before you go down, notice where your neck is in a neutral position, meaning you're not going to be tilting to one side or the other. What often happens when we come down to the ground is if we use a big pillow, you're ending up actually tilting that right side. So in this case, the right side would be shorter. The other side is, if I don't use anything, the left side's shorter. So see if you can position your head so that it's in that same neutral position. So take a moment to find that. You can bring that left arm slightly forward, so instead of resting on the outer arm, you're resting more on the shoulder blade. And just stack your knees together, let the inner edges of the feet come together. Take a moment to let the left side of your body sink into the ground and relax. I like to start this one by breathing into my right side. So we're going to be working with the right side. And you might even take a hand right to that brachial plexus area, your right hand. See if you can breathe underneath your right hand. So get some movement with your breath. And notice how naturally that area will expand as you breathe in, and gently compress as you breathe out. So for this movement, we'll be using our breath as the guide. So we want to find that breath, particularly in that upper chest area. Think of breathing into your rib cage and in the right side. Then go ahead and place your right palm on top of your left. And next time you take that next breath in, begin to slide your right hand along so the arm is relaxed, but I'm going to slide my right arm along and just begin to roll the right shoulder blade towards the floor behind me. Just part way first. Maybe I'll stop with my hand at the shoulder, even in the elbow. And as I breathe out, I'm going to roll back. So for the moment, I'm just doing this, slide my arm as I breathe into that area and letting my head roll with the shoulder. Like my head is still, my nose is staying over my chest, the middle of my chest. So you think of keeping your nose in line with your little sternal notch right there. So let the head follow. And don't push it, just go as far as you can. Rolling. You might notice too that your knee's moving. If your knee's moving, then some of this rotation is coming from your hips. That's all right for now. Just notice that. And then if it feels okay, as you start to roll, take your head a little bit further towards the right and maybe begin to bring your right elbow down towards the ground, but the elbow's still bent. And then come all the way back. I'm going to show this from the other side in a moment too. So you're going to slide, take your gaze a little bit further to the right. By the way, if you're falling off your pillow or whatever you have, just pull it a little bit more to the right side so you're still supported. Elbow might touch. And come back. So on the inhale, you're filling and rolling, and you'll start to feel that stretch right in that pectoral area, the right side. And if it feels okay, I'm going to turn this way so you can see as well. You're still on your right side. What you can do is you can take this, whoops, I got to go this way. So I'm going to turn the other way so you can see. And if it feels okay, as you slide that arm, if the elbow's coming down, go ahead and extend it and reach through the hand. Look out towards your right thumb. And then turn your head back the other way towards your opposite shoulder. And then release, push through the hand, and turn and release. So just like we did in the chair, you're going to flex the wrist, push through the front of your wrist, and turn your head. Feel that stretch right through the head of the arm bone in the right. And then turn the head back and relax. Do a few of those. And then slide your hand back onto your body. Roll back to your center. I'm going to come back. Doing my right side, we'll do one or two more. Palms start together. Use your breath as you breathe in. Feel like your breath is rolling you on towards that right shoulder blade. And then once you get as far as you can go, drop your elbow. Extend your arm. Reach so your fingertips will go down to the ground. You're going to push through the palm of the hand and then turn towards the left shoulder. Focus right in that area in the front of the right shoulder. Release the hand, roll your head back. So think of as you release, just letting the whole arm be heavy towards the ground. Turn again, push. So your nose is looking at your left hand, and your right hand is reaching your right wrist crease. Release. Hand back on your body, come all the way back. We'll do one more of those. And on this last one, if you want to challenge yourself, so if you haven't felt a lot of discomfort, again, as I mentioned, so these are important rotator muscles in the spine. A lot of times we think we're rotating up here, but it's mostly our hips. So what you can do to stop that is to take your right knee and drop it down to the ground. So it's on top of your left knee, kind of like if you're sitting in a chair and you're crossing your legs. And try that. So that's going to prevent the pelvis from rotating. So you're really going to have to focus on rotating from the upper body. So rotate slowly. You may notice you can't go as far. You maybe just get the elbow down. If it feels okay, extend the arm. Push through the wrist as you turn towards the left shoulder. And the head's heavy. I'm not picking it up. I'm just letting it roll. Think of that relationship again from the right side of the neck all the way through the arm. And releasing. Head at a neutral position, slide it back. You can pause for a moment on your left side. Maybe even give yourself a hug or rock. If your hips feel locked up, you can make little hip circles or just rotate your right shoulder around. Be playful. And then we'll be switching sides, so you can just flip over, flip and flop. I'm going to flip and flop. So we're on our right side. And again, not so much lying on the outer right shoulder, especially if you have this condition, it's not going to feel good. So you can kind of bring that right arm forward so the weight is resting on the shoulder blade on the back body. And then putting whatever you need to feel like your neck is neutral. Both sides, the right and the left, are equally long. Let the arm relax, that right arm. And just pause for a moment first. You can place your left hand in your upper chest area and breathe into that space. Or think your ribs, your rib cage on your left side. Breathing right underneath the collarbone and those upper ribs on the left. Just land and locate in your breath first in that left side. Check to see that you're letting the ground hold you. Everything that's touching the right side is completely relaxed. And then take your palms together. Begin to slowly slide the left arm up the right arm. And as you do that, keep the nose in line with the middle of the collarbones. And let your head roll with your shoulder. And you might just go part way first and then come back. So I like to roll on the inhale. I think of breathing into this area to make space in that left pectoral area. Take my pillow to the back a little more. Sliding it. And this is a condition that I do get on my left side. It comes and goes. So I'm really being extra sensitive and aware and kind to remember I want to stretch it without feeling that zinging feeling. And then as you feel okay, you can start to go further. Maybe the hand just comes across the chest, or you might find you can get your elbow all the way down to the ground. Remember, the head's heavy and supported by the ground. If you're bending the elbow and it still feels okay, then go ahead and start to extend that left arm out, and then just look at your left thumb. Might do just that a few times. Think of creating space from right underneath the left ear to the tip of the left fingers. Lengthen. And then on this next one, in addition to, I'll show it on this side, in addition to the left arm being extended, push through the hand to reach and turn your head the opposite way. So you're going to push your left hand and turn your head to the right shoulder. So you should really feel something going on right in the head of the arm bone there and the side of the neck. Release that. You can do that a few times with the arm extended. This one gets right into those pectoral muscles. The other one is working a little bit more in the neck muscles, and this is in that pectoral region. And then bend your elbow before you come back. Slide the hand back, let the palms come together. Let's do another one. Slide the arm. Let your head slowly rotate like it's following your left shoulder blade and your left elbow. Extend the arm and then push through the hand so you're flexing your wrist. Turn the head to the right. And then release. Feel your shoulder blade go heavy. The base of your skull is supported. Turn your head and push again through the wrist crease, the front of the wrist and the fingers. You could go so far as to turn your fingers under the tips of the fingers like that if you want. See how much you want and need. Come back. And we'll do one more. I wish you could smell. I'm getting nice earth smells here, reminding me to stay grounded and to let my body be supported. The smell of dirt in the spring. Extend that arm out. Just take a few turns. Oh, I forgot our trick too. I'm going to come back that if you find, and this is my case, that a lot of the rotation is coming from your waist, your low waist, then what you can do is take that left knee, drop the inner knee to the ground so your left knee is on top of your right, and it'll intensify it a little bit because you're going to have to rotate from the upper body now. Take it over. You can push through the wrist, turn your fingertips towards the ground as you turn towards the right shoulder. Wow, see, for me, that's that knee drop is the big difference. Tell me what you feel. I feel it now going all the way down and through the palm of my hand and out my middle finger. Through the wrist. You'll also notice too that if your hand is lowered down towards your hip, you won't feel as much sensation as if you keep the palm at the height of the shoulder. These are all little things. And then take it back once again. Just pause. You can roll your hips in circles. You can roll your left shoulder around. And take your time coming up. Thank you for joining me for this practice, particularly to my patrons, and thank you for subscribing. And again, I really enjoy your comments. Hopefully you don't have this condition, but if you do, or if you don't want to have it, let me know if this video helped. Peace, joy, love, and light.